evening and welcome back to the clinic. My name is Dr. Latenight and I will be your physician tonight as always. It is so wonderful to see you again. I hope you've been well. So tonight you are here for, yes, a hearing exam, but with your eyes closed. More specifically, the beep test. Okay, perfect. Well, of course, I recognize you from our previous appointments, but I just need to confirm a few basic things before we get started, if that's okay. Perfect, okay. So, what is your full name, please? Of course. Thank you for that. And your date of birth? Excellent. My final question for you is, have you noticed any changes in your hearing recently? Okay, that's good. You haven't noticed yourself asking people to speak up more than often, or more than usual, excuse me? Okay, nothing out of the ordinary. Good. Well, perfect. That is what we like to hear, but of course it is important to test your hearing along with your other senses periodically, just to make sure that there's nothing going on beneath the surface, no issues that we need to be aware of. Okay, perfect. We'll go ahead and lay back in the chair, just relax. This is a very easy test. In fact, we encourage you to keep your eyes closed the whole time. That way you can just focus on the sounds with no other distractions. But if you prefer, you can keep your eyes open as well. Okay. Perfect. So if you so choose, now is the time to go ahead and close your eyes. Close your eyes. Listen very closely. I'm going to play for you today a variety of different frequencies, or beeps if you will. They should not be jarring at all. They are intentionally at a low volume so that they will not disturb you, okay? But I'm going to play them in different series, and I'm going to ask a variety of different questions, okay? So just try to pay attention to the best of your abilities. Sound good? Okay, perfect. Firstly, I'm going to play you frequencies all the way from 300 Hertz up to 900 Hertz, okay? And for each of these frequencies, starting off, I just want you to tell me if you can hear them, okay? Easy enough. You can either say yes, or you can raise your hand. Let's begin. This is 300 Hertz. Could you hear that? Excellent, okay. Moving on to 400 Hertz. And could you hear that? Okay, did it sound a little bit higher than the last frequency? Excellent, okay. Moving on to 500 Hertz. Here's what that sounds like. Could you hear that one? Okay, perfect. And now for 600 Hertz. Could you hear that one? Perfect. And did it sound a little bit higher in pitch than the previous frequency to you? Excellent, okay. Just 3 more. This is 700 Hertz. Okay, could you hear that? Excellent. Again, this is 800 Hertz. hear that one? Excellent. And finally, this is what 900 hertz sounds like. Could you hear that one? Okay. And did 900 hertz sound like the highest frequency of all the frequencies that you heard? Yes. Excellent. That is just what we want to hear. Okay. So that was a little bit of a warm-up. Next, I'm going to play a pair of frequencies for you. So one frequency directly followed by the other. And I want you to tell me if frequency A or frequency B sounds higher to you, okay? Are you ready for the first pair of frequencies? Excellent, okay. This is frequency A. And this is frequency B. Okay, and which one sounded higher to you? Excellent, okay. We'll do this a couple more times, okay? For the next pair, ready? This is frequency A. And this is frequency B. And which one sounded higher out of the two of those, A or B? Excellent, okay. And once more, I'm going to play one more pair of frequencies for you. And again, just tell me which sounds higher. Ready? This is frequency A. Okay. This is frequency B. And which one sounded higher between those two? Excellent job. Now, just one time, I'm going to play 3 different frequencies back to back, okay? And you're just going to do the same thing. Tell me which one sounds the highest to you. This time there will be frequencies A, B, and C to choose from. Are you ready? Which one sounds the highest? Frequency A. Frequency B. Or frequency C. Okay. Could you tell which one was the highest frequency? Very well done. Okay. Alright. You did very well with that portion of the exam. Next, I'm going to play again 2 frequencies for you. And this time, you don't have to pay attention to the pitch. All I want you to do is tell me if frequency A or frequency B played for a longer period of time. Okay, so which frequency of the 2 do you hear for the longest? Are you ready? And we'll do this just a few times, okay? Which frequency plays the longest? Frequency A or frequency B? Which one played the longest? Good, frequency B that time. And again, which one plays for the longest amount of time? Frequency A or frequency B? Which one played longer that time? Excellent, frequency A. Now we're going to do the same thing, but I will play 3 different frequencies for you. Once more, and this is the last time, I want you to tell me which frequency plays for the longest amount of time. Ready? Frequency A, frequency B, frequency C, and which one played for the longest amount of time? Excellent, frequency C that time. Very good job. You're doing very well. For this next test, I'm going to play what 400 hertz sounds like to you, for you, okay? So listen carefully. This is what 400 hertz sounds like. Okay? And just try to remember that, alright? I'm going to play a very long series of frequencies for you, one after the other. And whenever you hear 400 hertz, I want you to raise your hand or say yes, but just indicate to me that it is 400 hertz. And I will play what that sounds like one more time for you. Ready? Again, that was 400 hertz. So whenever you hear that, just give me some indication. Are you ready for the frequencies? Okay, let's begin. Good. Excellent, yes. That's right. Yes, good. Excellent, excellent job. And you gave me an indication every time you heard the 400 hertz frequency. You aced that test with flying colors. Excellently done. Alrighty. For the next test, I will play a trio of frequencies for you, okay? And these frequencies will either be ascending, getting higher, or they will be descending, getting lower. I want you to identify if they are getting higher or lower as the frequencies progress. Does that make sense? Excellent. Okay. This is the first trio of frequencies. Just listen very closely, okay? Are you ready? And now. Good. And were those going up in pitch or down in pitch? Excellent job. Okay. We're going to do that again. Okay. So I will play you another trio of frequencies and just tell me afterwards if they're going up or down. Ready? Let's go. Very good. And were those going up in pitch, higher, or lower in pitch? Excellent. Excellent job. Okay. We're going to do that one more time before we move on to the next test. Here is the final trio of frequencies. Ready? And go. Very good. And were those going up or down? Excellent, excellent job. Okay. This next test may be the most difficult, but do not worry at all. Just do your best, okay? Some people, even who don't have problems with their hearing, get a little tripped up on this, but it's no reason for concern, okay? So, for this test, I'm going to play for you what 300 hertz sounds like, and then what 400 hertz sounds like, okay? Then I'm going to play either the 300 or the 400 for you, and I want you to identify which the frequency is, 3 or 400. Now these are very close in pitch, so they're going to sound very similar. If you don't get them all right, no worries, but let's try it. Okay, so this is what 300 hertz sounds like. Okay, and this is what 400 hertz sounds like. Okay, and I will play them back to back once for you. 3, then 400. Ready? 300. 400. Good, okay. Now I'm going to play a frequency for you, and you must identify if it is 300 or 400 hertz. Are you ready? This is the first frequency. What was that? Excellent, 300. And again, what is this frequency? Excellent, 300 again. And listen closely. What is this frequency? Good, 400. And again, what is this frequency? Excellent, 300. And what is this frequency? Good, 400 again. And the final frequency. Yes, 400. Very, very good job. I know that was difficult, but you got all of them correct, so I applaud you for that. Okay, my friend, you passed this hearing exam with flying colors. Whenever you feel comfortable, you can go ahead and open your eyes again. Or if you want to take a little nap here, that is not uncommon for patients after this specific test. Okay. You did incredibly well. I don't have any concerns about your hearing at all. And I thank you for trusting me to be your doctor as always. Alright. Thank you so much for coming into the clinic, and have a wonderful rest of your evening. Good night.